So we're going to go ahead and get started. My name is Elizabeth Aloni, and I'm with Schneps Media. Schneps Media is the largest local media company in Metro New York. We publish over 70 newspapers, magazines, websites, webinars, podcasts, and events throughout Queens, Brooklyn, Manhattan, the Bronx, Westchester, Long Island, and Philadelphia. Today, we're thrilled to be able to bring to you the webinar, Train for a Career in Healthcare. Today, we're going to discuss the career path into the high demand world of healthcare positions. We have with us today experts from the Medical Training Institute of New York, as well as staff instructors who are experts in their fields to discuss the top healthcare programs, what to look for in a training program, and certification that leads to a successful career. First, I'd like to introduce some of our panelists. First, welcome Belkis Pena. Belkis is a student. Hello, welcome. Belkis is a student course specialist at Medical Training Institute of New York, where she helps students obtain a career certification in the health field. Belkis has worked for more than 15 years at the Continuing Education Department at CUNY in the Heights Hostos Community College, where she helped approximately 3,500 students successfully obtain their certificates in various educational programs. In 2017, her hard work was recognized amongst her peers at CEANY conference, where she was given the Outstanding Experience Continuing Education Professional Award. Working with students that are looking for guidance and an opportunity is her way of giving back to the community that opened the doors for her when she first arrived in this country. Welcome, Belkis.
Thanks.
Next, I'm happy to introduce Cindy Keitz, student course specialist. Cindy is a Southern California native with a background in government contracts and in the movie industry. Relocating in New York in 2008, she was recruited by the director of CUNY in the Heights Adult Continuing Education, where she remained for 5 years, holding positions such as senior program coordinator, marketing and advertising director. She had scholarship responsibilities. She built a large portfolio, and she helped develop new programs. She also had the honor of helping plan regional conferences and attend many national ones, as well as other responsibilities. Cindy has helped bring to life a dream shared with a mentor to open a private college specializing in medical courses with locations in the tri-state area and expanding across the country, with the intention to do all that was possible to serve what was best for the students, faculty, community, and affiliates, instead of focusing on the bottom line. We now bring to you Medical Training Institute of New York. Welcome, Cindy. We also have with us today some instructors from MTI who will be able to answer course-specific questions. They're going to have an opportunity to speak to each of you about their area of expertise. Welcome to Donna Castellano, Dr. Daniel Arzani, Dr. Addie Turner, and Genevieve-Marie Lewis. Looking forward to hearing from them shortly. So I'm going to go ahead and share with you my screen. So MTI, where you can train for a career in healthcare, training for a career that is in high demand, is so important during all times, but particularly during these difficult, challenging times. And I'm excited to be able to bring to you these unique opportunities. MTI offers programs to start a career as a pharmacy technician, in medical billing and coding, as a clinical medical assistant, and as a dental assistant. These are some of the topics we're going to talk. We're going to talk about admissions, why attend MTI. We're going to get into the healthcare programs, learn about hands-on training, and so much more. So admissions to MTI. Once you start to admission, really, it's a congratulations in taking the first step toward educational and professional growth. MTI Online gives you access to a rigorous, accredited, and high quality education and training without putting your life on hold. In addition to the benefits of national certification and accreditation, their top-ranked programs offer asynchronous programs that are convenient, flexible, and led by an award-winning faculty. You're going to be able to apply online at www.mtiofnewyork.com. And we're going to provide to you both this email and phone number that you see on the screen. It's going to be available to you in the chat function shortly. And then we're also going to share it with you in an email tomorrow so that you'll know exactly where to be able to get more information and to apply. So something unique about MTI is the way that they support students from the application process to the acceptance process and beyond, obviously, to graduation and to a successful career. So as soon as you begin your application, a dedicated enrollment counselor will guide you throughout the entire application process. And we all know how applications can be challenging. It's so wonderful to know that as soon as you put your foot in the door, you're being supported. Once you are accepted to the program, your dedicated student course specialist is going to be there to provide support and any questions you may have, from questions on textbooks to registration to tuition. So this is going to give you tremendous support along with the support of the faculty, your academic advisor, your course instructors, and of course, your fellow classmates. So diving in a little bit deeper into what a student can expect from an MTI course specialist. They're going to be able to help you with notifications about textbooks and other course resources. They can help you with posting announcements about course. You'll be able to get course or schedule revisions. They'll assist you with course registration. They'll assist you with your change of address, your phone, your email. If you need to contact a faculty member, you can go to them and ask them for help. They'll help you to navigate the course site using course tools and general course information or questions. So what's wonderful is right from the beginning, when you get started, you have hand-holding with someone who can help you get through all of the questions you may have so that you can focus on being trained, learning, and getting ready for your new career. Belkis, I would love for you to share who the right student is for MTI. And Belkis is just going to take herself off of mute in 1 second. You're still on mute.
Thank you.
Perfect.
I got it. Thank you. Do you have a high school diploma or GED? Do you love helping others? Do you want to make a difference in the world and live in a better place? Are you excited in getting certified in high demand healthcare career job? Would you like to get diploma from an accredited agency? Are you interested in a school that's student-centered with small classes? Would you like to have a faculty and instructors that are practitioners as well, teacher in the field? If you answer yes to any of these 7 questions, MTI of New York might be perfect for you.
And these are really great things to think about, the high demand jobs, that is so very important because you want to do something that you love, but you also want to do something that there's going to be a job for you afterwards. And so being able to be in a high demand career is really critical. And I think not enough people put an importance on that. And that really is something you should think about no matter what it is you decide to do, is that make sure that your career is going to have high demand for careers. And the fact that your faculty and instructors are practitioners as well as teachers, it really shows about thinking about the after school and about the career for the rest of your life. Thank you so much. So I want all of our attendees to think about, do you have yeses to these questions? Because if you do, then MTI may just be the perfect fit for you. And that's exciting. Next, I'm really thrilled to introduce officially Genevieve-Marie Lewis, who is a pharmacy technician instructor at MTI. Genevieve-Marie, can you start out with telling everyone a little bit about yourself?
Absolutely. So as our host said, my name is Genevieve-Marie, and I have been in pharmacy education, specifically pharmacy technician education, for about 11 years now. It'll be 11 years this summer, actually. And I've just been teaching and training pharmacy technicians in the field, as well as in a classroom setting, just to kind of prep them for what they'll be experiencing when they do finally make that career move, or even if they decide to further their education and go into pharmacy school.
That's wonderful. And again, someone who knows what it is to work in the field. So would you tell us a little bit about the program?
Absolutely. So the reason that one should, consider becoming a certified pharmacy technician is because you can actually keep your job while you are in fact attending classes. And that's a great thing, right? Like that work-life balance is so important to so many people now. And then incorporating a school element can sometimes be challenging, but we're here for you guys and we are very flexible. And because of that, it's probably a really great idea to go ahead and come on board as a student with us. The PTCB exam, which is the national exam that's accepted in all 50 states for pharmacy technicians, is a program, or it's an exam that we kind of have modeled our curriculum after to make sure that you guys are ready to take that exam and then ready to jump right into the field. You want to make sure you become certified for a number of reasons, but then also with our program, we have the opportunity for you to become IV certified. And just very quickly, what that means is, if anyone's ever visited a hospital and you see someone hooked up to a bunch of tubes and bags hanging from different areas, those bags have very vital and important intravenous fluids in them. And so within our program, that's going to be one more thing that you guys are going to learn. You're going to learn how to make those fluids. You're going to learn the importance behind those fluids and why our patients need them. So again, it's just one more aspect of why you can come on board. We're going to train you in a lot of the robotic systems that you'll see nowadays in pharmacies, whether it's Omnicell or Pyxis or MedCarousel. There are so many different robots that are used, but we're going to train you guys on those as well. As I mentioned before, we definitely prep you to sit for that national exam that is offered by an accredited agency called the Pharmacy Technician Certification Board, or the PTCB. And one of the best parts of the program is that we offer internship programs. So it's not just an in-class setting. We definitely partner with pharmacies in all of the boroughs to make sure that you guys, after your training, can go into a pharmacy setting and actually get super amazing hands-on training. One more thing, the field of pharmacy is going to grow very quickly. It's already set to grow at least 4%, okay? At least 4% over the next 8 years. So, I mean, there's job opportunities already. And if it's gonna grow even 4% more, the opportunities are endless.
That's fantastic. And again, highlighting not only is there a high demand for jobs now, but that over the next several years, 10 years, it's just going to continue to grow. So talk about job security. I mean, those are like the key things you want to find when you're picking a career is can I get a job? And can I keep a job? Or can I move to another organization and continue my career and feel that I'm stable and secure in my career? So that's really very important. Thank you for that information about the growth, because I think that that's a really critical piece. I also think it's very exciting that you offer internships, because I think one of the hardest things when you're starting out is, people want you to have experience to get a job, but you need a job to have experience. And so to be able to have a program that not only trains you to prepare for the exam, but also in all the latest and greatest robotics and everything that's happening right now in the field, the fact that you can help with offering these internships allows your students to build a resume that then helps them position themselves in a much stronger way when they're going for a position.
Absolutely. Thank you for reiterating that. It's so important. And it's an opportunity that not a lot of schools offer. So that's just one more thing that kind of sets MTI apart from other schools that may be offering healthcare field programs. But definitely, as you mentioned, the internship is such a vital part of the program.
Absolutely. Absolutely. Thank you so much, Genevieve, for sharing about that.
Thank you. Thank you.
Wonderful options for some of our attendees. So next, I'd like to introduce Donna Castellano, and she is the instructor for medical billing and coding. Welcome, Donna.
Thank you very much. Good morning, everybody.
Share
So-
about yourself, please.
Okay. I have been teaching in the medical billing and coding class at Westchester Community College and the College of Westchester and a couple of other schools for 18 years now. So I've actually watched the field evolve, and I totally cannot underestimate how important this field is. I bring to this program extensive experience as well in the area of healthcare administration, having been an administrator and director of operations at some of the largest medical centers in New York. And I bring to all my classes the real world experience with the textbook knowledge. And so we can, give the textbook sometimes a reality check. I'm also a certified online instructor, and believe it or not, I'm a certified contact tracer for the COVID-19 initiative. Over the years, some of the classes that I have taught for 18 years would be health insurance and reimbursement, medical office administration, introduction to healthcare, medical terminology, global health. So I have a well-rounded view that I can present in my classes to the students. I just want to touch briefly too on how I view my teaching. I realize that I'm not teaching subjects, that I am teaching people. So my goal is to teach the whole person, everything, the cognitive, affective, and behavioral dimensions of the human being. I encourage my students to become lifelong learners, okay? And it means sharing what they learn and realizing all that they haven't discovered. I really want my students to become empowered by their own learning. So I present them with situations that they can take charge of and use in whatever their careers are, okay? If you want to go to the slide.
I just want to say I love that. I mean, number one, obviously your experience, you have significant experience, but I love the way you're talking about, really teaching to the student. I said like a wow when you said, I don't teach subjects, I teach students, I teach people.
It's so important. Yeah.
Critical.
For everybody benefits when we look at it through that prism. Okay. Now, as I said just a minute ago, I've came into the healthcare field before medical billing and coding. So I've seen the industry without it, and I've seen the industry now with it so sophisticated with electronic records. So when we look at this first slide and ask ourselves, why become a certified medical billing and coding specialist? Why is it so important? Okay, I don't think people realize that medical billing and coding specialists are vital to keeping costs down. They reduce medical mistakes and generally ensure that there's a free flow of information about the patient's medical histories. So in other words, medical biller and coders are such important members of the team because they keep the healthcare facilities up and running, and they actually do save lives. So if that appeals to you, that's what an overview of medical billing, and maybe in a way that you haven't looked at it before, but clearly that's exactly what it does, and that's what makes it so important. So to look at now, what do billers and coders do? Okay, and I'll jump to the third line. Is there a difference between the biller and coder? Absolutely. We clump it together in all of the programs of billing and coding, but the positions couldn't be more different. Okay, so what does a medical biller do? Okay, I'd like to start with the coder first, because actually the coder is the first step. The minute a patient enters the doctor's office, the clock starts ticking in something called revenue cycle. All right, the money has an actual cycle from when the patient shows up until the patient leaves. So what the coder does, as the patient's being examined, the doctor is checking off all these codes as he's going along. How sick is the patient? How much time did I spend with the patients? Everything has a code. So when we call it patient encounter, is finished, the coder is the first person that gets a look at that encounter. And what they do is they check to make sure that the doctor's notes and those codes line up. And then once that review process is done and the coder is pretty sure or absolutely sure, not pretty sure, because coding is such an exacting activity. When the coder says, yes, this is ready to go, that's where the electronic health record system generates the bills, but then the biller steps in. The biller doesn't generate the bills. The electronic health record system does. But then the biller is the person who starts to follow the bills. Okay, so what they do is they await payment for those bills. They get to see how long is that bill out there. Is it 30 days, 60 days, 90 days? Then they are the ones that initiate the process of reconciling the bills, asking, reminding, and requesting payments. They're the ones who initiate any collection actions that might be necessary. And then they handle if there's any appeals to those bills, and then any determination of those appeals. That's everything that the biller does until the final payment comes in. All of that falls under the biller. So the biller picks up after the code is assigned, and now we know how much that encounter is going to represent, $400, $500, $1,000. Then the biller starts looking for that money, and wherever that process takes him. Direct payment, that's terrific. If it's a late payment, do we have to really, do collection? Is there an appeal? That all falls under the biller. So as I said, the roles couldn't be more different. Okay. Looking at what are the requirements. Once again, you don't need a college degree to get into this program. I've taught people at all stages, people who've just wanted to change their career, people who retired and decided I want to do something from home and went into medical billing and coding. But basically you do need to have a high school diploma. Okay. How long does it take? We always want to know, how fast can I get this? Actually, it depends on, there's many programs. Some programs will do it in a year. Some programs will do it in 2 years. A lot of schools now have made these programs associate degrees, so that now you're looking at 2 years. So that would be your expectation, depending on, how much of a degree do you want this to be. The next line, when we look at the accreditation, I have to make the distinguishment right up front. When you finish this program, you are not certified. All of these programs are not certifications. What these programs accomplish, in order to sit for these certifying exams, you need to have completed a program. So the program gives you what you need to go and then sit for a certifying exam. These 3 bullets, the American Academy of Professional Coders, the American Health Information Management Association, and the National Healthcare Association, these are what we call accrediting agencies. They're the ones who generate the test. They're the ones who give out the certifications. And that's why if you look at the very first line, become a certified medical biller and coder, because certification is what you want to accomplish. In New York and in most states now, you need to be certified. But that's an important distinguishing, because I've had many students come and say, okay, when it's over now, I'm certified. And the answer is, no, you're not. Okay, you have to sit for this. So that's another step that you have to be aware of. Okay.
Donna,
And lastly, as long as I'm teaching, the job outlet for this particular position, medical billing and coding, has always been above any other field that we look at. And you could go on to the Bureau of Labor Statistics, you can go anywhere. And right now, for the next 10 years, it's 8%. It's been about that 8 to 10%, because that's how important this is. You will always need to have somebody who will have to check those codes. There's areas of compliance to make sure that people are not undercoding, overcoding, but the bottom line is that this is such an important field. We can't have this field without billers and coders. So I would highly recommend it as a consideration. And it's a very exciting place to be. And it's not going anywhere. And you will be employed. And that's what you want to be employed. So thank you very much. I wish you well with all of your career choices. Thank you.
Thank you, Donna. You really explained that very well, to know the difference, like what does a medical biller do versus a coder do. And I do have to say, one of the things that is so stressful when people go to the doctor is paying their bills
Yes.
and dealing with their bills. And so when you say, you know, medical billing and coding positions, they are so important to the patient. Very often, they're one of the few forward-facing individuals with patients, and they're dealing with patients, you know, during potentially could be a stressful time, whether it's an illness issue or just a financial issue. So, you know, making sure that this is done right and done with care, and looking at people as not just those that you're billing, but as human beings, as you do look at your
Yes.
as human beings, not just as a subject.
Yes.
You know, that really makes a very big difference and is hugely important to any medical office, because, you know, I know personally, you know, going to the doctor, if you have an issue with the medical billing team, or, you know, it really taints your view of your whole experience. So that position is so important to make people feel that they can trust the office, that they feel comfortable with the office, and really feel safe. Again, what a great point to make about not only the need for this position now, but the growth. Again, very, very important when you're looking at a career. Make sure that there's a high demand for the position, and that long term, there's going to be a demand for the position and a growth in the position. So again, this is a very important statistic. This 8% growth
Yes.
is a very important statistic to think about when you're deciding on a career for yourself.
Absolutely. Absolutely.
Thank you so much, Donna. That was well said. I
You're
appreciate
so welcome. Thank you.
it. So now I'm looking forward to hearing from Dr. Addie Turner, who is the instructor for the Clinical Medical Assistant Program. Dr. Turner, welcome. Can you please tell everyone a little bit about yourself? Oh, you just have to take yourself off mute.
There you go. I'm on camera, but on mute. Good morning, guys. Well, my name is Adi Turnier. I've been teaching for the past 20 years or so toward various institutions within New York City and also in Virginia. I teach various populations, which is bilingual, trilingual, and also fluent in French, Spanish, and English.
Wow.
I'm teaching presently online to 1199, the union, the student that needs to progress to go further in their learning career. Excuse me, let me slow down because I feel the train is coming by. Then I will put on mute while I'm speaking, so you guys do not get the background noise. Yeah, so my interest right now is teaching clinical medical assistant, which is a program that is very, what would I say? It's a lot of demands on the students because you'll be learning the basic sciences, which is really a time-consuming to learn the basic, because we realize it took me 7 years and medical school and 2 years for the basic science. And my intent is to teach it the best that I can in a short period of time. And this is what we have. And it's not as complicated. And my job is to make it fun and interesting to people who do not have the background necessary for the complete understanding, because we're not going to go as much in detail, but me is to make sure that you understand, not so much to memorize and to remember how the circulatory system works. No, it's to comprehend, because if we have the basics, if we understand what we need in basic science, whichever field you choose to continue your career on, it's going to be a lot simple. So at that level is where I focus a lot. And after learning the skills, the basic skills, I think you guys will have the tools necessary to continue. So again, we'll be doing in clinical medical assistant. It's two different parts. We have a clerical part and we have a medical clinical part to the course. A clerical skill is learning how to take care of chart, how to interact with patients when they come into the office, and to files and all those clerical work you're doing in a medical atmosphere. The clinical part taking vitals, doing EKG, doing the 12 lead EKGs. Those skills are the skills that we will be concentrating and hoping that my experience and the skill that I've acquired, I'm able to share that with you. If there's any more, again, like I think, like Donna mentioned earlier, the certification is the same. Once you finish with the course, you will have to be certified by the state of New York. And every state will probably require a different certification. So it is incumbent upon you, once you finish, to see which certification you want to lead towards. That's all I have for you now.
Wonderful.
But looking forward on teaching, and this is my joy, this is my love, is to impart this information.
I can tell, you know, the students are very lucky to have an MD teaching the class. And it's a very special talent to be able to, because obviously as an MD, you have so much experience and so much education. And to be able to take all of that and bring it to its most basic form and be able to train clinical medical assistants with the information they need to know, without, you know, overwhelming with the things they don't need to know, is a real skill to be able to balance those two things, and to have, you know, an MD as the instructor to be able to do that and let people know, you know, the importance of a clinical medical assistant and how you work with them in your field.
And I must add, most of the students that I have taught, after learning the clinical medical, after acquiring the skills, most of them have gone on to nursing school or have come on, because I also teach medical surgical techs, medical assistant, surgical assistant, who have worked alongside doctors doing surgeries. And just the love you acquired doing those skills, you say, wait a second, I didn't know it was that easy. It is easy. It is very easy to cut. Once you have the basic, the door is open.
Well,
and this is what I'm trying to do with all and part with the students.
Well, it's very easy when you have a good instructor who ignites the passion. I think, you know, so far that, you know, and I know that we'll feel the same with Dr. Arzani, but, you know, so far the instructors, I mean, you could feel their passion for what they teach. And the reason why, Dr. Turnier, that your students feel it's so easy is because you've made it so easy for them to learn and feel good about themselves and to feel that they can accomplish. And so, you know, really, you cannot speak more about how important who is teaching you is. And I think, you know, Dr. Turnier, you're a perfect example of, you know, what MTI brings to students that is so unique, which is, you know, passionate individuals who are knowledgeable and care about the student's future. And you do that. So that's wonderful. Thank you. And take a look at these numbers here. A 19% growth in this industry. I mean, that's spectacular. So again, you know, all of these positions, as we're seeing, not only are they hot now, but they are going to stay as important job prospects in the future. And as Dr. Turnier said, there's also additional opportunities to expand beyond if you find interest in other areas that relate to being a clinical medical assistant. So, you know, this may not be the end of the journey of the learning journey, but it's certainly an exciting start to it. Thank you so much, Dr. Turnier. I appreciate it. So next up, we are going to welcome Dr. Daniel Arzani, DDS, and he is the instructor for the Dental Assistant Program. Welcome, Dr. Arzani. Can you please? Hello. Can you please share with our attendees about yourself and your background?
Hi, good morning. I'm Dr. Arzani. It's great to be here with everyone today, and I hope spring is starting off fresh for everyone. I'm looking forward to being your instructor for the Dental Assistant Program here at MIT. I'm a general dentist by profession, but engaging in academia is something that I've always thought is important. And I'd like to thank Ishmael and Cindy for bringing me on board to help prepare students for a workforce that is about to grow. And we're all up in that growth. There are numbers that, according to the best reference that could back this up, the US Bureau of Labor Statistics Employment of dental assistants is projected to grow 7% from 2000 to 2029. So about 18 years left. And this is faster than the average for all occupations. So it sounds legit, and I'll take their word for it because there are facts that could back that up. It's good for everyone getting involved. This means that you will have some nice opportunities. And I see many opportunities that MTI can afford students with their infrastructure, their network, and their curriculum. And I think there are a lot more things that we can do for the students to set you up and give you some value. Because the information is in the books. That's the textbook stuff. But what are you going to do after that? That's really where I want to get involved and help you, because there's, especially with dental assisting, there's a lot of different paths that you could take. It could be a very techie path that you could take, and there are other ways that you could kind of navigate the profession that we could talk about. Everyone is getting smarter as we have access to more information, and they get that information faster. So linking oral health to general health is an intuitive concept, but more people will seek preventive services. People want to care and keep their teeth for more obvious reasons, and more assistance will be needed for more routine tasks to improve office or treatment efficiency. So you will be very valuable. You are very valuable. I'm looking forward to providing some insight on this to help develop careers like after MIT as well. So I commend you on your timing. That 7% is nice. And especially after last year, making the choice to help this profession is also very commendable. You should also give it up to the old timers, the baby boomers, all right? Because they're real and you're gonna see them everywhere, all right? That's going to be the population. More people, more teeth, and also a lot of old dentistry coming back, right? Old crowns, old fillings, stuff like that. And each person has up to 32 or more teeth. It's called hyperdontia, so it adds up. So there will be, or is already, more need for dental assistants. Nice choice, everyone. I'm looking forward towards our growth.
Thank you, Dr. Arzani. And, it really, I've learned recently too about how much dental health is connected. Like your dental health has to do with your heart health.
Yes, absolutely.
I had no idea. So, that's something very interesting for people to know, how critical it is to be in the dental field, because it's really a very core, importance to be able to take care of your dental hygiene, because it will affect your entire body.
Absolutely.
And then also, what about everything that's happening in the cosmetic field of dentistry?
Absolutely. There's another route that you could go. There's so many routes you could go: cosmetic, beauty, surgery, the tech portion, the laboratory side. There's a lot of things that you could do to bring value to a dental office that they might not even have, that they might not even have considered. But you have that skill. You could add to your skills after MIT. Like I said, these things in the textbook that we'll go through, things out of the textbook, but you could add on your skills and then really build your profession, build your career, afterwards. So it's a long-term thing.
That's exciting at MTI because, Dr. Arzani talked about, obviously he has tremendous experience as a dentist and in his being able to teach dental assistant program. But I love what you said, and again, it's echoed what the other instructors have said, is about helping you after your education in being able to find a field that you can be good at, that you can excel at. And what he just said now, in areas that you can find expansion for yourself that, maybe isn't even there around yet. You can create something within, the dentist program that you're working for. So I love a program like that MTI has, where it's about getting and keeping and growing a career. And Dr. Arzani really drove that home, as the rest of our instructors have been talking about too. So thank you so much for that.
Thank you.
I would like to jump over to Belkis again, and I would love for her to share about the benefits of attending MTI. Can you share that with us, Belkis?
Sure. The benefit of attending MT out of New York, hands-on clinical training with a state-of-art equipment you find in all hospitals, interviewing tips and career services, job placement, experienced faculty and staff, career service assistant, career coaching, in-person and virtual professional development events, free access to online job posting, and career resources, our employer partners.
Terrific. And what you see over and over and over again in all of these, career, 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 career. Everything is moving, is looking to your career. I can't begin to tell you how critical that is when thinking about a program to join for your career, is that the school is as focused on your career as you are. Thank you, Belkis. Cindy, I would love for you to share with us a little bit about what is included with an education at MTI of New York.
Well, I think what's so special about MTI of New York and what separates us from all the other adult continuing education colleges is that we believe in taking the higher and extended steps to support the students and make sure they're getting as much possible education, both for their dollar and their time. We have mandatory requirements for all our instructors to also be practitioners in the field that they're teaching. And that is not something that other colleges demand, but we do, because we feel the instructors can bring something extra, again, both practicing in the field that they're teaching. We also give the students not just in education in the field with their instructors and the textbooks, but when they have also passed their exams and passed their classes, they then have to be prepared to go into the world. And we do feel that as book smart and as world smart as you are, sometimes this might be the first job that you're actually going to interview for. So we put the students into workforce interview type classes where they learn how to interview, what to wear, how to answer questions, how to present themselves. And again, that is something that only MTI of New York absolutely puts into their programs. We also provide for every student when they pass their classes, and we don't send students out without definitely having an internship or externship, both in the didactic and clinical positions. So if, again, they're not just finishing by, we've gotten your money, you've gotten your learning experience, good luck. No, again, the way we hold their hands coming in, we hold their hands till they're happy in a job position, guarantee that internship and externship positions. We also, for our pharmacy division, we have USP 800 compliant clean rooms for the pharmacy. We're the only college to have that across the United States.
Wow.
All our classes, even though right now we're only offering online hybrid classes due to the COVID situation, but hopefully by the beginning of summer, we'll be moving to our new facility in Manhattan. And again, we have the USB 800 compliant clean rooms for pharmacy. All our classrooms are state of the art, as well as all our medical equipment. We're affiliated with all the top hospitals and clinics in New York. We do have career development skills. All our exams, as all the instructors for the different classes, they all are board exams. We do access online job posting and career resources with our employee partners that the students will all have access to. And all our faculty and staff advisors, as Elizabeth explained in the beginning of the presentation, we don't just take your money and then, again, this is your room assignment and that's it. MTI again, it's not really hand holding because, again, all the students having passed at least a high school diploma or GED, you are adults. And whether you're 18 or you're 80 and you're starting a new career. So, but we want to be your advisor, we want to be your friend, and we want to be, again, your career partner, helping you get there. And MTI, we feel that, we're not, again, just a building or just a PO box, just taking your money. Because of COVID, there are some restrictions as far as scholarships and financial aid, but we do definitely work on payment plans. So you just need to work with your program advisor to talk about that. You're welcome to go to the website, mpiofnewyork.com, to get more information. And of course, call the numbers that Elizabeth will have posted and are posted on the website to make sure that you can talk to us. There is more advantage, again, having online classes, that the classes will not fill up as quickly as they might having just a brick and mortar building, but we will be starting classes in just a few weeks. So we're here to answer any questions that you have. And we really hope we provided you at least enough information to get your brain started and your questions started and your taste for starting a new productive career that could be your best future for your family. Thank you.
Cindy, thank you so much. You know what? One thing I love about all of you is you could hear the passion in everyone's voice about MPI. And, you know, that's something that is so important when you're looking at a new home for you. And I don't care how old you are, Cindy, it's always nice to have people holding your hand and helping you through. And that's really very special. So wonderful. Thank you to all of you. We have some great questions from our attendees that I'd like to get to if you are all ready for some wonderful, wonderful questions. So Susan had a question. Do you train in software, a Prima, Epic? She mentioned as a couple of those.
Epic usually is for the medical billing and coding class. And if I'm right, Donna, we're going to be using Metasoft for now, and then eventually switching over to the Epic. Is that correct? Donna?
She's just on mute right now. Donna,
Yeah, you're on mute. So if that's, yeah, I think Epic, again, right now we're going to be using Metasoft for that class, but we will be quickly switching over to Epic.
Great. So there will be software training.
Yeah, the software is used. I mean, for, you know, clinical med, again, as Mr. Turner explained, there is online clerical as well as clinical for clinical medical assistant. But the software she's talking about most likely is for the medical billing and coding.
Terrific. Thank you so much for that answer. Donna, you're still on mute. I know you want to say something. Oh, she's having a hard time with mute. You know what, Donna, if you're having a hard time, just send something in chat to me and I can say whatever it is you wanted to say. I don't know why she's stuck on mute, but you know what? Sometimes there are technological issues. We all get that. So George wanted to know, where can he find out the cost for medical billing and coding program?
He can call and get one of the representatives. I mean, I have it right now, but we prefer to talk with students individually about costs and, you know, discounts and things like that.
Terrific. I already put here in the chat for everyone the website and the phone number, both the admissions office and the toll-free number. So I suggest right after this webinar, give a call and you can get all those details that you need. Rhonda has a question. Is there a placement program for coders and billers?
If she means job placement, then as we said, we definitely put people, if they, by the time they finish the class, they haven't been searching for a job, then we do provide a guaranteed internship or externship, which in any field, a lot of times those lead to jobs. And so, you know, we can't obviously provide that once a person is in an internship or externship, they'll get a job there, but that on a resume definitely gives a 32% increase of securing a job.
That's great to know. And that is really a great point. I mean, having an opportunity to do an internship is an opportunity to get in front of the employer and show them how great you are. And, you know, great employees are not always easy to find. So if you make a great impression, if you don't get a job, you can also ask for a referral. So the internship is really, really a valuable opportunity to kind of show your stuff. Thank you for that. Nancy has a question. How long is the medical and coding program?
Again, it changes because if you're taking a day class, it's a certain number of hours, an evening class, a certain number, a weekend class. So it's probably best again. So it's people that aren't interested in a particular course, she can call one of the course specialists and we can deal with her directly. We'd be happy to spend as much time with her as needed.
Fantastic, fantastic. So please, if you have any specific questions that we don't get to here, please do call. And call either way, because there's so much more information that you can get that's directed specific to you. Ksenia has a question. Hello, what are the requirements for dental assistant program?
For any of the classes right now, the only requirements again is you have to either have a GED or high school diploma. There are no other, again, this is adult continuing education. None of the programs are degree based, like a, 2-year, 1 year, 4-year, that's not it. So just a GED or high school diploma. None of the other courses have any kind of math skill requirement like pharmacy used to have years ago. There's no other skills required. Once you enter the class, the individual instructors might give you some basic skills quizzes, just so they better know what level you're at to, best know how to help you in any deficiencies and or any bonus skills that you have.
Terrific, thank you. Valeria wanted to know the final certification for billing and coding, is it AHIMA or is it CNA?
CNA is for a certified nurse assistant. So that would not be related. Donna, do you have information about the first
Yes.
certification?
Actually, AHIMA is the name of the accrediting agency. So the accrediting certifications that you get would be CCS, CCP. There's so many of them. It just depends on, do you want certification for a physician's office, certification for hospital coding? So based on what you think you want to do, where you want to do that coding, that agency would have an exam just for that. But CNA is a certified nursing assistant, and AHIMA is the name of the agency. So that's not a certification. The certifications are the ones that I just told you, but there's, so many of them based on where you want to go and do it. That's what you would look for.
Thank you for clarifying that for our attendee. Ondine had a question. Is there a difference between a clinical medical assistant and a physician's assistant?
Addie, you want to take that?
Dr. Turnier?
Yeah, I'm coming. Definitely. The physician assistant has to go to school for a longer period of time, because you are the shadow of the physician. You could even write an order, a prescription that has to be co-signed by the doctor. Definitely, the two different fields. You will need longer education for that.
Is there any need, would you suggest someone become a clinical medical assistant first?
You could use your CMA as a stepping stone. Like I said, from CMA, you probably could go to nursing school. You could go apply to nursing school. I really like to insist that you must understand. I think most of the thing that holds students back from pursuing a career is the fear that they have, that they may not be qualified, they may not have enough math, enough science, enough biochemistry. But once you get the basic skills, there is a level of confidence that you acquire that pushes you, that propels you forward to take the next step. It will not be surprising. Once you finish, you go on to learn to become a physician assistant. You go to school, you go back to college, and you get the classes that you were missing.
That's such a good point. Success breeds success. As you accomplish something, it gives you more energy, more belief in yourself to accomplish more. So certainly, this is a wonderful place to start. And again, look to these instructors. You know, it makes such a difference in an education. I mean, I would be blessed to be taught by any of these professors, any of these instructors, because of their passion and their devotion to their students. And what a great springboard for your career to have people, and to have MTI have people both from a faculty perspective to administrative perspective, to be able to support you and push you forward in the career of your dreams. Really, really important. Thank you, Dr. Turnier. That was really meaningful. Carolyn, wants to know, where is the New York City school located?
We have MTI built a brand new walls up from ground up facility, and it's right near United Nations. Again, because of COVID, right when we're about to open, we're still, even though a lot of schools are opening, we are still on restrictions to only offer online classes. But that's where the Manhattan home location will be. Another great thing about MTI of New York is that will be a home location, but we are expanding to Florida, New Jersey, California, and then eventually to other locations across the country.
Wow.
So, yeah.
So these, when a student takes a course with MTI and does certifications, are most of these certifications, because I know that one of you mentioned about it being really a countrywide certification. Are most of these certifications countrywide, or are they more state specific?
Donna or some other teachers might be better. Some are both. You have to just, each field has different ones. As far as MTI though, when we open the brick and mortar, some classes, for instance, medical billing and coding, such a large percentage of that can be done online. Some of the other ones, for instance, pharmacy or dental, they do have a large component that would be better taught to have your clinical hands-on, but the classes that can easily be done online, even when we open the brick and mortar, we will have cameras placed in the classroom, so we can have people from all across the state and even to other countries be able to still take our classes. But Donna, you have more information?
Sure, I do. With the certification, one good thing I will tell you, most other states respect anything from New York. So, but you know, certification, the most important thing with your certification, it is accepted in every other state. They just want to know you're certified. It's different than licensing, whereas licensing, you can take a license that has what's known as reciprocity. So if you take a license in New York, it's automatically assumed that it's accepted in Connecticut and New Jersey because the states are so similar in location. Certification doesn't work like that. Companies or hospitals or medical centers, they just want to know you're certified. But what's very important and is a big responsibility with certification is that you keep your certification up to date. So you have to recertify and renew it every 3 years. And so that's the most important thing. But certainly you can go to any state. But the first thing to do when you do relocate, we tell everybody this, check with the state. You know, will this certification be okay? Because it's always changing. But for the most part, everybody I know that has passed the certification has moved everywhere, and they haven't had to, you know, retake anything.
That's great to know. The education stays with you. The certification stays with you. So
exactly.
Successful. This is a great way to start and get your education, get the people behind you who really care, who get you started, and then you're free to fly, right? Mm-hmm. And they hope that you do because of all the support. So that's really wonderful. Thank you to all of what a terrific crew here. Cindy, Belkis, Dr. Turnier, Dr. Arzani, Donna, Genevieve. Thank you all to being here with us today and sharing about MTI. I know I'm excited about it. I hope that our attendees are as excited. I do want to let everyone know we've recorded this entire presentation and we will send you the link tomorrow. So you'll have the link. It'll also be available on the Schneps Media YouTube channel. So you can watch it again. You can share it please do share it with friends and family in your community. Also, you will get an email tomorrow that will have the website and the phone number, but I also put it in the chat right here. You can grab it. Again, it's www.mtiofnewyork spelled out .com, and the phone number 212-204-8577 or toll free 800-559-5935. Again, this will all be emailed to you. Also, it'll be recorded so you can hear it again, so you will not miss it. Please don't hesitate. Get your career started, and they'll be very excited to welcome you with open arms and get you started on your career journey. I want to wish you all to stay healthy, stay safe, and cheers to your new career. Have a great day, everybody.
We want to thank Elizabeth for being a fantastic presenter and director, and Schneps Media for all their help also. Thank you.
I think we have one
pleasure.
question. You have a question from somebody about the school.
So one question just came up is the Manhattan location offer both medical assistant and physician program?
The actual physical, right now we're only offering the 4 online classes, and then you can actually go to our website to see the expanded courses once the building opens, or when when the spring / beginning of summer new classes. If we can't open the brick and mortar location, we'll be offering more classes online. And you can see more of the medical centered courses that we'll be offering on the website.
Look, nobody wants to go. Everybody wants to stay and ask more questions. I love it. Thank you so much. Our attendees, you are fantastic. Thank you for your passion. And please reach out to them at MTI. They can help answer any questions that you have and help get you started on your career path today. Have a wonderful day, everyone. Thanks so much.
Bye.
Bye-bye.
Thank you.